Hi, this is Steph Shellhammer. I'm going to be working on the week 7 discussion question. The question was, Jason Pontine shares that he believes big problems can be solved with the use of technology. How could you apply his 4 elements into the field of healthcare to use technology to solve all the healthcare problems in the U.S.? So his 4 elements were that political leaders and the public must want to solve the problems. Institutions must support solving the problems. There actually must be a technological problem that technology could solve, and we must understand the problem. So I really enjoyed his discussion and thought there was a lot of real life applicable examples to kind of help illustrate his points. So kind of what I started to think about was kind of improving healthcare of Americans overall. Thought about healthcare reform with the Affordable Care Act that passed, in 2008, that it started to address some of the issues with American healthcare, but fell short in several areas. Also, the HITECH Act of 2009 helped address some of the technological areas, but again, probably fell short in some ways. So I think that some of the ways that it fell short was there doesn't seem to be a lot of patient responsibility in a lot of the legislation. So I think for Jason's first thing about political leaders and the public wanting to solve the problem, I'm not sure that we're there yet and have fully committed. I think political leaders kind of put their toe in the water, but didn't want to fully affect voters negatively in any way because they are at risk for, losing elections, losing their livelihood. So for them personally, status quo might not always be that bad, at least through the next election cycle. But in the long term, that doesn't improve our health. So I think that's one way in which using that first step that we've maybe not fully committed to being there. What I mean by personal responsibility is there doesn't seem to be penalties for non-compliance. So a hospital would get dinged, so to speak, for readmissions for a heart failure patient, but if the patient ate sauerkraut after we told them specifically don't go home and eat the sauerkraut and came back to the hospital, it's a hospital responsibility, but the Medicare still covers the patient's bill. They still, can go on business as usual. There's not a real consequence for personal actions. The second step with institutions supporting is, I think, kind of a symptom of that culture that's created with the political and situation. So much of the current structure of payment is still fee for service, even though, in some ways we're going away from that with bundled payments and accountable care organizations, but not every insurance plan is structured that way, and not every hospital is, going towards that direction. So there's still pockets of fee for service when you're trying to do bundled payments. So it makes it difficult, I think, for institutions to fully commit to changing their model of care, because even if they are doing an accountable care type plan, they can't fully commit their resources that way because they're still billing and things the other way with the fee for service. So I think institutions are sometimes hesitant to kind of fully adopt the thing that we would think would be more positive and centering their things around the patient and looking more at patient well-being through the continuum instead of just encounter-based. Again, I think then the next step would be the technological problem. Is it a technological problem? And I think there are some instances where parts of healthcare problems are technological. Do we have, the information of the testing that was done down the street at our hospital? I think we're still working on building those bridges. I think that we're making a lot of progress on, getting information more quickly to different organizations, on being better about, trying to get on same computer systems or being able to integrate, at least be able to see each other's records in the same thing. But obviously there's more work to go there. But again, is it a technological problem? There's a lot of pieces that aren't technological. Just because we have the technology that can do it, are people accessing it correctly? We have the technology that tells the patient what to take when they go home, but does that mean that they actually are going to go out and take that? We have the technology to say what people should do, but does that mean they can afford to do it? So I think not all of the issues that we're seeing are technological, so it's difficult to say that this is 100% a technological problem. Although components we could certainly improve with technology, I think we have to be able to look at the bigger picture. And that brings to the fourth point of, do we understand the problem? And I'm not sure that we always understand or want to understand all the components because, again, you know, we don't want to say to individuals, you have to look at your health and what you're doing, and we don't want to say to a specific hospital or a specific doctor, you shouldn't be doing it that way. So technology, I don't think, could solve it all, and I don't think we have a clear understanding of exactly where we're going wrong in our current healthcare system. So I think that's where we need to do more work. We need to, you know, look at all of the testing and all of the procedures and everything that we can do, and do more study on, is that really beneficial and is that really going to help our patients? So I think that kind of sums up my thoughts on his points and how that applies to healthcare overall. And I think on all 4 points, we probably have more work to do to be able to say that we're really committed to solving this problem. Thanks.